so it's me, Elaine. I just wanted to make a update follow-up video about Accutane and also my scar treatment. So today I had my fourth microneedling treatment. I had a total of 4 microneedling treatments spaced out about 4 weeks apart, so a month apart, and um, you know, microneedling is known for helping acne scars. And so I wanted to try it out because I talked to my esthetician and she mentioned doing microneedling. And then she also mentioned other treatments because I don't know if you guys know this, but acne scars tend to need a multimodality approach. A multimodality approach is an approach where many different techniques and treatments are used to help lessen or diminish the appearance of acne scars. And I have all types of acne scars. I have ice pick, sorry. I have ice pick, atrophic, boxcar, like all those types of scars. So I just wanted to show you a close-up of my skin because it's really red right now. And this is I just had my procedure done around 2, so like 2.5 hours after the procedures. You could see it's really red, and my skin's really shiny right now because she put like moisturizer and cream to help it like with the healing process. As far as pain level goes, microneedling is pretty painful. I would rate it like maybe like a 6.9 or basically a 7 out of 10 for pain. That's because I just have a really low pain tolerance threshold. So yeah, they numb you for about like 30 to 40 minutes, and then after they numb you, sorry, it's cold. After they numb you, then they start doing the treatment. And she didn't do a roller. She actually did the Dermapen or the Rejuvapen, and the Rejuvapen basically it's a lot different than a derma roller, where the Dermapen, it just projects the needles in a uniform pattern, and they use like this pen to do it, and there's like 12 needles that are being ejected from the pen, and as she glides the pen, the needles then are pricking your skin at like a really fast rate, and so it's pretty painful. It feels like sandpaper, like what you would imagine sandpaper to feel like, being like really like harsh and onto your skin. So you would think it's kind of ablative, but I don't think it is ablative because it really can go only so far into your skin. And so yeah, as far as results are concerned, I did notice a minor improvement, like I would say 25 to 30% improvement, and I know that doesn't seem like a huge change, but I have to accept the fact that I have really difficult scarring to treat because I had severe acne, and it's not like I had superficial acne where they could easily treat those types of scars. Since my infection was so deep into the dermis, I had lost a lot of collagen, and it's not that easy for you to replace that collagen. So she talked to me about this. This is called Bellafill, and I don't know if you could see it, but there's one side where the girl has acne scars, and then there's another side where she doesn't. And that's the result of Bellafill. And Bellafill is, I don't know if you guys know what Bellafill is. It's a filler, and it's made out of bovine collagen, and bovine is from like a cow. And so basically it's just supposed to help lift up the depression and make it as smooth and even as possible to the rest of your skin, the skin that has remained intact and not damaged by the acne. And let's see if we can show you some of the pictures here. These are just examples of atrophic scarring, and the circled areas here are the ones that were treated, and this is after. So this is before and this is after. This is before and this is after 12 months. And basically this is a semi-permanent filler. So results can be seen I think immediately, but then it's not, I don't know how to say it, like semi-permanent. It's permanent, but it's not. So it's kind of confusing and kind of hard to explain, but I am planning on getting this. They actually tested me. In order for you to get Bellafill for your cystic acne scars, you have to have a skin test done where they inject the filler into the forearm. I don't know if you could see it, but they look like little bug bites. But they inject it and they see if you have a reaction to the filler. And if you have some type of allergic reaction or skin rash or something, then they typically don't recommend that you get Bellafill. But if you don't have any type of unusual reaction to the collagen and to the filler, then you are basically approved to get the filler. Now, Bellafill is really expensive. Let's just say, for example, okay, so each treatment for my microneedling was around $300. I had 4 treatments, and it came out to be $1,200. And just for one syringe of Bellafill, it's $1,000, and half of the syringe, it's I believe it's $500. So I have a lot of atrophic scarring here, not so much in this area. I have a lot on my left cheek because that's the place where my skin was really hit hard by the cystic acne. So I have a feeling that I'll be spending a lot more money for my skin. But you only live once, man. You gotta look your best. So if you can try to improve it, why not? Yeah, so it's been a long journey, from Accutane to now treating my scars. It's been a long journey, and I feel like I've been on it for like not 10 years, but it's actually been only like almost 2 years now. And I actually didn't wait that long to get treatment for my scars. I know they say you have to wait at least like 6 months to get any type of scar treatment. I didn't do lasers. I just opted for microneedling because it wasn't that expensive, and I didn't want to do any like ablative procedure right away because you don't know like what the laser is going to do to your skin. So I just opted for microneedling because it's less invasive, and the downtime is like 3 to 4 days. So yeah, I have a dermatologist appointment coming up on December 10th, and I'm going to see the actual dermatologist instead of the esthetician, because usually the esthetician or the nurse does the microneedling. And so I'm going to do subcision, and that's where they go under the scar and they break up the scar tissue and release those fibrous bands that are holding the scar down, and then it'll kind of help elevate the scar. And then I think I'm going to talk to him about doing fillers. As far as TCA cross goes, I'm not sure if I'm going to do that. Maybe I will for my ice pick scars, but I don't know. There's just a lot to think about and a lot to do to help improve my skin. I know I look like a crazy mess right now, but I really don't care. I just want to make this video for you guys, especially for those who are suffering with cystic acne scars or who are suffering with acne in general, because it's going to be a long arduous journey, and I just want you guys to be aware of your options after you have treated your skin, because when you live with acne scars, you feel like you still have acne, and when you look in the mirror, you're reminded of what you went through, and that's kind of painful. And it really does take a toll on your self-esteem and the way you talk to people and the way you just live your life. So I feel like if I can kind of help those people who are thinking about taking Accutane but aren't sure because they want to go the natural route, save yourself the grief and the embarrassment and the trauma that goes along with cystic acne, and really, really consider taking Accutane, because it is a one-of-a-kind drug, and it will really change your life. Like, I'm not exaggerating. Some people may have had bad experiences with Accutane, but if your skin is so bad to the point where it's just covering like 60 to 70% of your face, you might as well give it a shot. Like, you really don't have any, how much worse can it get, you know what I mean? If your skin's already bad. And then so that's all I wanted to talk to you guys about. This redness will persist for, I don't know, another 72 hours, and then after the third, fourth day, my skin will be peeling and it will go back to normal, and I will still have some of my atrophic scars left because I really have some deep ones. So that is all. If you guys have any questions about my microneedling experience, or just if you think you should get microneedling, just leave them in the comment section below. I'll try to get back to you as soon as I can, and I hope you guys have a great Thanksgiving, and I'll talk to you later. Bye.